Okay, so we'll pick back up in this video with fibromyalgia. We kind of got cut off in the middle of the last one. So fibromyalgia is chronic muscle pain syndrome. Can also be called fibrositis, myofibrosis, fibromyositis. Typically, it's now common to just be called fibromyalgia. Manifestations include chronic muscle pain, neuroendocrine and sleep disruption, tender points in the muscles and soft tissues, including the joints, also headaches and depression. Massage is indicated for fibromyalgia due to the fact it's going to reduce pain and improve their sleep patterns. The cause of fibromyalgia is unknown, but the text suggests it's possibly due to low serotonin levels or emotional trauma. Treatments for fibromyalgia include massage, pain and sleep medications, antidepressants, muscle relaxants, nutritional changes, and supplementation, exercise, stretching, and acupuncture. There's 18 points that are typically sensitive or tender with fibromyalgia clients. And to determine whether or not a client has fibromyalgia along with a history background, typically the doctor will say that they have fibromyalgia if they have a certain history, they have the other manifestations, and if 11 of these 18 points or more are sensitive. This is a picture, and you also have a picture in your textbook of the 18 points. Whenever these points are sensitive on your client, it may be an indicator that they do have fibromyalgia. However, remember, you cannot tell them that they have fibromyalgia. You can simply tell them they need to speak to their doctor and emphasize that they need to, write down all of their ailments and present that to their doctor. Next up, on page 239, we talk about muscle strain. A muscle strain involves torn muscle tissue. It's characterized by mild to severe localized pain, stiffness, and inflammation. Massage is contraindicated locally during the acute and subacute stages. So you want to wait a few weeks typically before you do a massage on a muscle strain. Indications: massage is indicated for muscle strain due to the fact that it breaks up adhesions and scar tissues, it reduces edema, and restores range of motion to the nearest joint. You can do massage everywhere except that specific area of the strain until you get through that subacute stage. Key finding of resisted range of motion test for suspected strain injury will probably reveal pain with the primary action of the muscle involved, and also pain with active movement. When the body starts its healing process in the acute phase of muscle strain, it deposited a dense network of collagen fibers at the injury site. These fibers are arranged just kind of in a random pattern. Because it's not really aligned with the fibers and the surrounding layers of tissue, it tends to kind of bind down the surrounding tissues. They have a tendency to kind of stick together and they create fascial adhesions. So therefore you want to go in and do gentle movement to help to kind of rearrange that fascial adhesion, or to break down the fascial adhesion and try to begin to rearrange the deposited scar tissue or the randomized fibers that are deposited. Even though the fibers build up the scar tissue, it still creates weak spots within that structure. So that's one of the reasons why once you injure a specific area, especially with a muscle strain, you tend to re-injure it over and over and over. So your clients a lot of times will have the same problems for really long amounts of time, or off and on for the rest of their life, just because they're re-injuring the scar tissue that's there because it wasn't adhered properly. And then finally, we've got tendinopathy. Tendinopathy is an injury or damage to the tendons and their fascial sheaths. Tendinitis is the most common injury you see as a massage therapist. Specifically, it involves injury and inflammation of the tendon, usually at the union of the muscle and the tendon, or the muscular tendinous juncture. Tendons have limited blood supply, so that kind of compromises their healing process, also delays the healing process. In acute stage, tendinitis is recognizable by pain, stiffness, and inflammation, as well as decreased movement. In the subacute stage, you'll have the adhesions beginning to form and your randomized collagen matrix. Massage is locally contraindicated in the acute stage, but systemic massage is okay, so you can massage everywhere except that specific injury spot. And then massage is indicated elsewhere or after the acute stage, subacute and later. Systemic massage is indicated because it increases circulation, breaks up adhesions or scar tissues, reduces edema, and restores range of motion to the affected joint. Then, of course, massage can be done also on the local site after the acute phase has healed. And that's typically your 72-hour time frame. The cause of tendinopathy is injury or inflammation of the tendon or chronic degeneration of a tendon. Treatments include massage, ice or heat, immobility of the affected tendon, pain medications, and anti-inflammatory medications. Common location includes the Achilles tendon, the forearm flexors and extensors, the bicipital tendon, the supraspinatus tendon, and the patellar tendon. Tendinosis implies to the degeneration of the tendon, and tensosovinitis implies to inflammation of the synovial lining or the tendon's sheaths. Now, with our MBLEX questions and stuff, we've found some other things that's kind of popped up that I just want you to kind of be familiar with. A couple of these should actually be on a different site, and probably are. The plantar fasciitis, I know we talked about that with cells and tissues. But again, it's a common form of fasciitis. It's caused by overuse. Calcaneal spurs, which is a bone spur on the calcaneus. Physical overload, weight gain, and abnormal foot mechanics, also improper footwear. Okay. Chronic fatigue syndrome is a condition related to tiredness lasting for more than 6 months, as well as other symptoms like sore lymph nodes and headaches. We also tend to have a lot of muscle soreness and achiness with chronic fatigue syndrome. Myofascial pain syndrome is a chronic condition characterized by cycles of pain, spasm, ischemia, and trigger points. Torticollis, this is an asymmetrical head or neck position where their head's kind of tilted to one side. It's related to excessive or inadequate muscle tone in neck muscles. So typically with torticollis, you've got one side that is excessively hypertonic, and the other side is usually weak. So you need to lengthen the hypertonic side and strengthen the weak side. Osgood-Schlatter disease. This pops up several times. It keeps, I've had several students in the past that keep saying that this came up on their test. So it's a condition involving pain and inflammation at the site of the quadriceps insertion on the tibial tuberosity. And we'll go a little more into that when we study the quadriceps in depth. IT band syndrome, or iliotibial band syndrome, can be caused by friction. It's a common form of fasciitis. And the common symptom is lateral knee pain, so pain on the outside of the knee. Shin splints, again, this should be with the bones, with the skeletal section, but it was left on here, so we're going to go with it. Shin splints is a general term used by lay people excuse me, to describe symptoms felt on the anterior surface of the leg. Flaccid, this is when muscles are said to be weak, soft, or lax. A rotator cuff tear is a tear in any of the 4 rotator cuff muscles: infraspinatus, supraspinatus, subscapularis, or teres, that should say teres minor. Teres major is not a rotator cuff muscle. Teres minor is. So that should be changed to minor here. Excuse me. A rotator cuff tear typically causes pain and difficulty with abduction and rotation of the shoulder. Whiplash. Whiplash is caused by sudden acceleration or deceleration force that causes damage to the muscles and ligaments in the region. We hear of whiplash with car accidents with their neck a lot. Myopathies. This is diseases of the skeletal muscles that are not caused by nerve disorders, and it causes the muscles to become weak. It's that muscular dystrophy. Typically, muscular dystrophy is a result of genetics, but it describes a collection of diseases with prominent characteristic of passive loss of muscle fibers. So the muscle kind of just deteriorates. Compartment syndrome causes pressure to build up in one specific area. Poliomyelitis, can result in permanent muscle atrophy. I've only had 2 clients in 14 years with technically it's post-polio syndrome, where they have the muscle atrophy from polio as a child. And obviously they're older. Polio is not really common anymore. Myositis ossifications. This is basically a bone spur. It's when muscle tissue is replaced by bone, usually at the site of a hematoma or a bruise, an injury to the area. And that finalizes our muscular system. Specifically, this video is on some pathologies of the muscular system. And as we go through each system and as we go progress along with class in general, we will still be kind of going back over and covering different pathologies with different systems and stuff as we approach, especially with the muscles and the bones and stuff. So we will be kind of continuing on with this, so don't feel like it's not enough information, because there will be more to come. But anyway, that's it for the muscular system. Watch your videos, take your quiz, and send me the information, your assignment. And then when you're ready to schedule your test, you let me know. And we'll see you next time with the nervous system.